Hi, my name is Dr. Matar. I'm a neurologist based at University Hospitals of Birmingham, and this is where my NHS practice is. And I also do my private clinics at Sutton Medical Centre and at Spire Leicester Hospitals. And I specialise in MS, as well as obviously other neurological conditions, but MS is my area of main interest. So that's an excellent question. So I think over the years, there's been numerous studies evaluating the importance of exercise in patients with MS. The vast majority of which have concluded lots of beneficial aspects in relation to exercise for those patients. And benefits ranging from symptom control to even sort of disease process, and that's been demonstrated time and time again. So obviously, not only does it benefit from patients with MS in terms of the symptoms related to MS, but also it has all the additional benefits of cardiovascular benefits, mood benefits, etc. So understandably, a very cost beneficial kind of treatment, if you like, is how I would think about it, and very successful, as proven by all the numerous studies that have been done over the last decades, over the last few decades, really. So yeah, so that I think that's the sort of simple benefit, if you like. We can go into sort of further details discussing each and every benefit to explain it to the patients today. So there's been, again, a few studies trying to answer that question, really, because it's such an important question. Although there's no 100% conclusive evidence in relation to any particular set of exercise, but there has been some perhaps more studied types of exercise that have, again, shown some evidence. So there's a lot of evidence for perhaps aerobic exercises, again, in certain groups of patients, and there's lots of guidelines there that would advocate a certain regime that involves regular sessions of aerobic exercise, perhaps 2 or 3 times a week, and reaching sort of a certain duration of time each session. In addition to aerobic exercise, there's been other studies evaluating yoga and Pilates and Tai Chi, and those seem to be providing sort of benefits specifically to patients with MS who have troubles with balance. And the studies seem to sort of show an improvement in those symptoms in patients, again, who are able to maintain regular participation in such exercises. There is some studies that have evaluated aquatherapies. So the idea being that sometimes patients with MS may have difficulty with exercise because it will raise the body temperature, and that can sometimes adversely worsen the MS-related symptoms. But it seemed that aquatherapies, for instance, negated that negative effect by keeping the body temperature a bit cool, allowing, again, people to participate more and be able to maintain it on a regular basis. There's been additional studies that have evaluated high-intensity training, and there is now a decent volume of evidence as well suggesting that incorporating that into any exercise regime can be quite beneficial for muscle strength, which is obviously important in patients with MS, particularly those who have been affected by any form of muscle weakness. And again, it seemed to show benefits on all the other aspects as well, fatigue, mood, cognition, etc. And there is more and more work now being done to evaluate essentially resistance training as well, to see whether that offers any additional benefit. And again, so far the studies seem to suggest that it does, both from symptom control and as well as disease control. So in summary, I'd say I think that the ones that have been evaluated so far are high intensity training, aerobic exercises, Tai Chi, yoga, Pilates, and resistance exercise. And again, there is more, but those are those are the key ones really. I think this is one of the issues when it comes to the design of the clinical trials in MS. One of the concerns has always been about safety and what exercises would be safe to do. And it's certainly, again, that going back to the point where it's always preferable and it's always best to have a tailored regime to your needs and to your ability. So certain patients may have troubles with balance or ataxia, for which if you sort of focus on jogging, for instance, you might not really find it safe to do. So it's more about the individuals really, and it always has been. I think with MS, it's very important to individualize care. We do that for our disease-modifying treatments. We should also be doing it for exercise because, again, everyone is different and their needs are different. So it all depends on the patient's ability and unfortunately their disabilities as to which exercises you would perhaps try and avoid and which exercises would be okay to do. Overall, I think usually when you start, let's say patients who have limb weakness, they might find, for instance, weight training or resistance training as hard and potentially unsafe. But it's about, a graded approach. You start small and you build your way up. With time, there will be an improvement in the ability that then allows you to continue and then make it safer for you to continue as well. But in terms of have there been any actual exercises in the studies identified to be perhaps unsafe? Not really. Again, it's always been about tailoring it to the patients. What I often tell patients is, because there's usually obviously the patients will experience difficulty when, particularly patients with MS will experience some difficulty when they try and sort of get into exercise for various reasons really, but the most sort of important one is usually fatigue. Now, and often patients will say to me, well, I do a lot of physical activity in my work, for instance, or as part of my day, and I often have to explain to patients that that's not quite the same, because when you're doing dedicated exercise, so let's say instead of perhaps walking the children to school, if you go to a gym or even at home, and if you get on a treadmill and do a walking session, for instance, that is much more likely to increase the heart rate to the target heart rate, where you start to actually reap the benefits. You mentioned dancing exercise. Again, it's very important for coordination, for balance again. And again, it will achieve the similar effect of raising the heart rate to the desired targets, where you then start to see the production of the neurotransmitters that we want to see, and that sort of degree of neuroprotection as well. And I absolutely agree. My advice to patients with MS on a day-to-day basis is that the last thing I want them to do is to join a gym and do a session of high intensity workout for 45 minutes or so, and then feel absolutely drained and fatigued for the following 2 weeks, and then never go to the gym again. The idea is to start with something that they enjoy, that they used to enjoy before MS came, and continue with that, and start small and build up gradually. So if someone enjoyed dancing and they were into it before they were diagnosed with MS, then that's probably going to be the best choice for them, because again, they're likely to be able to maintain it because it will provide that motivation, which is usually hard to find sometimes literally for everyone, for patients or healthy individuals. So yeah, and that's very important. And I think incorporating assessments by professionals, so physiotherapists and personal trainers, etc., can be really, really important at the start, because it then allows a tailored regime of exercise that will be suited to each and every individual. We're all very different in our abilities and capabilities on our sort of what we would call pre-morbid state. So it's important to take these things into account when it comes to designing an exercise regime, particularly at the start. That's where it's very important, because again, the last thing you want to do is start off wrong and then just end up not willing to continue. So what I always say is, once you've had an assessment by a professional, let's say a physiotherapist, and they've identified certain goals, perhaps there is some limb weakness that needs to be specifically targeted by strengthening exercises, then that would be the way forward. If it's something to do more with spasticity, for instance, then again, there could be stretching exercises, yoga, etc., that can be a bit more beneficial towards these symptoms. So it's about tailoring the exercise really to the needs of the individual and also to their abilities, bearing in mind that there will be other challenges as well, not just the MS, but physical challenges that may make certain exercises a lot harder than others. And the idea is always to slowly get into it. I know obviously there's lots of recommendations out there for certain perhaps regimes that are people might find very intense and very almost intimidating. My advice is to always start small and then make that sort of your long-term target is to get into these intense regimes. So the two main ones really is fatigue, and it's very understandable when people say, how can I exercise when I feel so tired all the time? And that's always the biggest challenge. Now, that's why a lot of the exercise studies and clinical trials are focused a lot on the impact on fatigue. And this specifically is perhaps where the evidence is the strongest in terms of the impact of regular exercise on fatigue and improving symptoms of fatigue. So that's the key thing to highlight to patients is, yes, at the start, it is very likely to be difficult and challenging, but it's the long-term or the persistence with exercise, that's when the benefits start to kick in, particularly improving fatigue, for instance. The other obstacle, what we mentioned earlier, is the rise in the body temperature that happens with exercise. And I think that's a common one as well. I've come across with patients who actually do regular exercise. They find that they used to be able to perform perhaps they go jogging, for instance, for 40 minutes or so, but now they can only do 20 minutes before the body temperature is really high and they feel really tired very quickly. And that's a tricky one. And that's what we were sort of talking about earlier, is trying to perhaps overcome that by cooling measures, whether it's using water, aquatherapies, or whether it's in a gym environment where there is air conditioning, etc., that allows the body temperature to stay kind of in the region where you're unlikely to experience a worsening of symptoms. Absolutely. So I think it's both really. this is a question that's also been evaluated in the clinical trials, and this has been studied both in animal models and in patients with MS in real world. And there is evidence to suggest there is certainly a beneficial impact from exercise on the immune system. It seems to modulate the immune system in ways that are beneficial. And there is evidence from quite a few studies that it can actually decrease the severity of the disease and the activity of the disease as well. There is a beautiful, well, there's loads actually, but there is a very nice presentation on MS Society's website that describes it as the unsung disease-modifying therapy, and that gives you the sort of the indication that it's and this is what I tell my patients, it is a treatment, not just sort of a lifestyle change. This can be very beneficial in terms of slowing the progression and controlling the disease. Now, what's been thoroughly evaluated is the impact on symptoms. And again, lots of studies. Obviously, the most robust evidence is for fatigue management, but there is also very robust evidence for improving cognition in MS. There has been certain studies that have been shown to improve processing speed and also improve language. There is a benefit for mood, certainly, and we all know obviously the impact of regular exercise on mood and the release of dopamine and endorphins, which can boost obviously the mood, which is a very common symptom in MS. Perhaps not as common as fatigue, but definitely very common. So it's both really. It has a beneficial impact on the disease process itself, as well as the symptoms caused by the disease. Hence why, in our practice, I spend a considerable amount of time with every patient highlighting the importance of exercise, and also going through and acknowledging the challenges that patients will face when they attempt to go into the regime, and trying to work with them to overcome these hurdles and hopefully start to see the benefit. I think I was, very interested in what you said earlier about dance and choreography. And again, this is my own sort of favorite strategy, is to focus on a sport or a form of exercise that you actually enjoy, because that not only is exercise, it also becomes more of a hobby as well, and that always boosts the neurotransmitter levels that are connected strongly to mood, serotonin, dopamine, etc. And that's a very key thing to understand, is it's far better to maintain any form of exercise that you enjoy on a regular basis than to try and start an exercise you've never done previously, and that's something that you perhaps don't enjoy as much, because you're likely to find it a lot harder to maintain that. And the key message from all the studies has always been about regular participation. That's always the key factor, because it's all good to just attempt it once and never do it again. That is unlikely to give any benefit, but it's more about being able to do it regularly. That certain regimes advocate five training sessions a week, which to a lot of people, even healthy individuals, is going to be very challenging. How do I find the time? How do I manage the fatigue? There's no way I can do this. But actually, if there is an additional motivation that you're going to be doing something you enjoy already, then you're much more likely to be able to achieve even something close to that number would be beneficial.